Dr. Claytor here. Many patients come in and say, listen, I don't know the difference between a full versus a mini tummy tuck. What's the difference? Why is one better? Is one a faster recovery? We're gonna make it very simple. Basically, if your problem exists across your entire abdomen, you should be looking for a full tummy tuck. If your problem, the area that frustrates you, exists from your belly button down to your mons, mini tummy tuck. It's that simple. Basically, a mini tummy tuck involves an incision that goes down here in the underwear, down to be hidden in a bikini, and the dissection up, but no further than the belly button. Now, a very significant amount of tissue can be removed, but that belly button doesn't move. It may be pulled down a little bit, but it stays attached to the abdominal wall where it is. So this piece of skin gets brought down to here. All of this would be removed. Now at the same time, you can come in with a liposuction cannula and liposuction all of this and thin it down. You can be removing fat from up here, but the amount of skin is only going to be removed down here. And it can do a very nice job in improving the contours and shape, and you can move to a better shape, but it's all focused down below the umbilicus. Now, what you can also do in here, because sometimes people will have a little bit of a pooch. If you look at a belly, you've got that little pooch, little bulge there. If here's the belly button. Sometimes what you have is rectus diastasis in this area, where the muscles have pulled apart. So you will actually be able to improve the contour and flatten the abdomen below the belly button by repairing those rectus muscles right here and pulling them together. And that can flatten that belly. That can make that a flatter, softer, more contoured abdomen. And at the same time, you can be liposuctioning, creating some nice body sculpting and contouring. A mini tummy tuck is just here. Now, if you were gonna do the full abdominoplasty, what that means is now the incision still goes here, but the dissection goes all the way there. You're dissecting all the way up into there, getting access to those rectus muscles that have been pulled apart, and you're gonna now be able to pull them together. Now there's gonna be your belly button that's gonna have to be reconstructed because you've lifted all that tissue up. You've probably excised a significantly larger piece of tissue on the abdomen, and that you're gonna pull that down. And when you pull that down, remember the belly button generally stays there and everything slides over top of it. And once it's inset and back down again, you've got that nice curvaceous abdomen that you've pulled down. Now you have to go deliver the umbilicus. And again, as I said in my other video, I like to make a small V incision so it's a little bit hooded. But that's the big difference between a full versus a mini tummy tuck. Talk with your plastic surgeon to figure out what's best for you. Thanks so much.